to the May 7th, 2024 legislative meeting of the Board of Spokane County Commissioners. Please let the record reflect that Commissioners French and Kearns are in the hearing room. We are joined virtually by Commissioner Jordan. Also for the record, there was no written comment that we received on any of the pre-printed agenda items. And we now have been joined by Commissioner Amber Waldriff. Okay. Perfect timing, Amber. Okay. So those that are able, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, that now brings us to Open Public Forum. Open Public Forum is your opportunity to address the board on anything that is not on our printed agenda. We do have two individuals who have signed up ahead of time. The first of which is Becky Dickerhoof. And Becky, we do have the letter that you provided as well. So if you would come to the podium, introduce yourself and address, and you'll have 3 minutes.
Hello, I'm Becky Dickerhoof from the Spokane City. I'm here today to ask the County Commissioners to enact what is commonly referred to as the 1590 tax. This ordinance, which amended RCW 82.14.530, allows a county legislative authority to impose a sales and use tax not to exceed 0.1% of the selling price in the case of a sales tax or value of the article used in case of a use tax. Currently, Spokane Trends, a website maintained by the Eastern Washington University Institute for Public Policy and Economic Analysis, provides data showing 53.9% of Spokane County spend more than 30% of their income for shelter, and 25.9% spend more than 50% of their income for shelter. As a result, many households are in a situation of housing risk. As rental costs increase, more of our residents will find themselves without a home. Spokane County is well aware we are experiencing a housing shortage, especially in the middle and low-income housing market. That market is often ignored for the higher-level houses with a higher profit margin. Lack of housing options causes high market prices and puts more Spokane families at risk of losing their housing when income does not rise to meet living costs. Currently in Spokane, a property is only available for occupancy for less than 3 months, meaning homes are quickly occupied when they become available. Simply put, we have a shortage of affordable homes in Spokane County. The county commissioners have a tool they could use to increase the supply of low-income housing. We all recognize this is a regional problem that needs to be addressed by the entire region. The county commissioners need to make every effort to become part of the solution. The number of homeless in our county is increasing, and if we are to solve that crisis, we must make more options available for those needing permanent shelter. This tax would be a start to solving our crisis. Thank you.
Thank you. Next up, Tim Kinley.
Hello, Commissioners. Tim Kinley. I'm here again demanding a 3-hour meeting with subject matter experts in election software, cybersecurity, and equipment. And here's why. They, with your permission, will tell you what your passwords are, every single person in here. They can break into any machine, even tabulators, but they don't because that's illegal. But with their permission, they can do that. Now, the reason this is important is because there's been many court cases out there where they have done this with permission of the court, and elections are being overturned. Criminal charges are being brought against people for election fraud, and it just takes a long time to go through the court process. But these things are happening where judges have been given their passwords, and they go, this is wrong, So they will explain the whole system with the right terminology and the right terminology so people can get it right, so that they know what they're talking about. So the other reason is we don't have a secret ballot. It is for some people that choose to keep it secret, and that when they get their ballot in the mail, they can hold on to it, fill it out. But in many situations, even in domestic violence situations, ballots are filled out for other people, whether it's spouses and or not, but it gets sent in. Plus, we have a number of ballots that go to people that aren't even in the county. And so they're filling out ballots. We have no way to track this down. We can track some of it down, but it's just a lot of work. So you can talk to just about anybody out there that says they get ballots for family members. And those can be filled out and turned in and signatures faked and whatever. And I've seen the signature verification process, and I've seen a lot of signatures go through that didn't match, and I've seen signatures not go through that did match. So, and I'm not the only one. So that signature verification doesn't do it. That's why we're really asking that there's a solid chain of custody in our election process. And from day one, when those ballots are printed, the chain of custody is broken, because we don't know how many are printed. It's not public. And a person could make a copy from their own computer and fax that in, and we don't know that. Either way, anytime we've been doing certifications, the numbers haven't matched. And they haven't matched in a significant number of ways, so that it could overturn another election or an election. Thank you.
Thank you. Is there anybody else wishing to participate in open public forum? Second call? Yes, sir. All right, if you'd come up, if you'd state your name and address for the record, and then Shelley here will give you a form if you could fill out for us.
Sorry, I'm a little late.
Oh, no problem.
First time to a commissioners meeting. Yeah, my name's Tom Schrum. I live at 135 West 31st Ave up on the South Hill there. And I just ask that Mr. French remove himself from any dealings with the PFAS issue out on the West Plains. You know, it's shown in reporting over the last couple of weeks that you knew about the issue. You either hid or didn't tell the public about the issue. And I think you've really destroyed any trust that we can have in your handling of this issue. There's lots of other commissioners here. They'll all do a great job. But it's really important to have trust in good government and to have people really interested in solving a problem. And your actions here have shown that you're not interested in solving the problem. You are interested in something else. And I'm not going to make any judgments on your motivations, but your actions say that you knew about the PFAS problem, you had an opportunity to take money to mitigate it, and you didn't. It's real simple. So I just ask, out of respect to your constituents, that you pick somebody else in the commission to really lead the effort. And I think there was some reporting in the Spokesman that the plan that you came forward with was easy to put together in a few minutes on Google. And that's not a serious attempt. It's a little insulting, honestly. And I know you probably feel this is insulting, being up here and asking you to your face. But I would really request that you work with one of the other commissioners, ask one of the other commissioners to really lead this effort, because your actions have shown that we can't trust you in it. Thank you.
Is there anybody else who would like to participate in open public forum? Second call? Third and final call? No one online? Okay, we will close open public forum, and that will bring us to some proclamations that we have. So I will, since I'm actually chairing today, I will read one of these into the record, and I will ask that someone make a motion based on the proclamation that I read into the record. So this is a proclamation. Whereas There are over 3,000 dedicated registered nurses, RNs, who represent the largest healthcare profession in the Spokane County region. And whereas the depth and breadth of registered nursing profession meet the different and emerging healthcare needs of residents of Spokane County in a wide range of settings. And whereas registered nurses in Spokane County are not only the cornerstone of patient care, but are also leaders in improving the safety and quality of care and seeking ways to continue increasing access to care. And whereas the demand of registered nursing services is greater than ever because of the aging of the American population, emerging health challenges, the continuing expansion of life-sustaining technologies, and the explosive growth of the home healthcare services. And whereas the Washington State Nurses Association, as the leading voice of registered nurses in Washington State, is working to create safe staffing standards through the power of one collective voice for RNs. And whereas the Inland Empire Nurses Association has worked to safeguard nurses' well-being since its founding in 1898. Now, therefore, we, the Board of County Commissioners of Spokane County, Washington, on behalf of the citizens of Spokane County, do hereby proclaim May 6th through the 12th, 2024, as National Nurses Week in Spokane County. We also ask residents to show their appreciation for Spokane County's registered nurses' contributions to healthcare by sharing a tribute or a special thank you on social media using the hashtag #NursesMakeTheDifference. Dated this 7th day of May, 2024.
So move.
Second.
All right, we have a motion and a second. Any comments? All in favor say aye.
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 Motion passes 4-0. And I believe we are joined today by Kathleen Thompson. Kathleen, if you'd like to come up and share a few words, and then we have a proclamation. We'd love to take a photograph with you.
Thank you. I was asked to say a few words about why Nurses Week is important. It gives nurses the opportunity to share with the public the barriers that they face in providing quality, compassionate care. Nurses in every work setting are confronted with violence in their workplace and are having to fight, no pun intended, for increased safety. Nurses in every work setting are working harder with fewer resources. This has been a long-standing problem that was just made worse by the pandemic. Nurses work in untenable conditions that lead to burnout. Nurses have unique expertise, and our U.S. healthcare system would collapse without nurses. Yet in hospitals, nursing care is not billable. Hospitals can add an aspirin to their charges, but not the nursing care provided. The public has rated nursing as the #1 most trusted profession for decades, and we are described as heroes. Although we appreciate the public's trust and confidence, we need employers to step up and invest in improving working conditions to stop the burnout and retain nurses. We just want to provide the expert and compassionate care we have been trained to provide. Finally, Nurses Week is important to provide public recognition of the critical contribution nurses make to the health of our nation. Thank you.
Thank you. If you'd join us right up here in front of the dais, we'd love to take a photo, and we've got the nice proclamation. Okay, that brings us to another proclamation, so I will look to Commissioner French.
Thank you, Mr. Vice Chair. I'll read this proclamation in the form of a motion. Whereas organizations nationwide are recognizing child care providers on this day, and whereas child care has provided a safe, nurturing place for the enrichment and development of millions of children nationwide and is a vital force in our economy, and whereas the pandemic illuminated how indispensable child care providers are for the well-being and economic security of Spokane County's young children, families, and communities, and whereas child care programs, which are mostly small businesses, run and staffed predominantly by women, continue to recover from the health and financial hardships stemming from the pandemic to meet the needs of more families, and whereas the future depends on the quality of the early childhood experiences provided to young children today, and support for high-quality child care represents a worthy commitment to our children's future. Now, therefore, the Board of County Commissioners of Spokane County, Washington, on behalf of the citizens of Spokane County, do hereby proclaim May 10th, 2024 as Provider Appreciation Day in Spokane County. And we urge all Spokane County residents to recognize and thank child care providers for their important work in our communities, dated the 7th day of May, 2024.
Second.
All right, we have a motion and a second. Any comments? Seeing none, all in favor say aye.
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 The motion passes 4-0. We are joined by Leanne Dixon. If you'd like to come up and share a few words with us, we'd appreciate it.
Hello, my name is Leanne Dixon, and I own Harvard Park Children's Learning Center. I want to take this time to thank you for recognizing what an important role child care providers play to our families and our community. Provider Appreciation Day originated in New Jersey in 1996 and has grown each year. I am proud that Spokane has joined the nation's collective gratitude for those who support cognitive, social, emotional, and the physical development of our youngest children. I'd like to take a minute to share the story of a few of my colleagues that you are honoring today. The education of the staff at Harvard Park includes 2 master's degrees, 4 bachelor's degrees, and 3 associate's degrees. Their combined years of experience working at my center total 76 years. They are hardworking individuals dedicated to creating a nurturing environment for which young children can thrive. They work tirelessly for our students, even though their average salary is just over minimum wage. This is a common story among child care centers across our country. I would also like to share a couple statistics. According to Child Care Aware of America, the child care profession is in the bottom 3% with regards to wages. This is after considering that families are already struggling to pay for child care at the current market rate. According to Child Care Aware of Washington, Spokane County has lost 35 child care businesses since 2019 because the industry simply cannot pay a living wage to its workers. U.S. Treasury Secretary Janet Yellen described child care as a textbook example of a broken market. Early education professionals are necessary for our economic system to thrive. We are necessary for the growth and development of our young children, and we need more help if we want this industry to survive. Your proclamation of Provider Appreciation Day demonstrates to our community that early learning professionals are worth supporting. As the proclamation states, our future depends on the quality of early childhood experiences provided to young children today. I am grateful for your acknowledgement and support of early learning educators. Thank you.
Thank you. And if you'd join us in front of the dais here. Okay, the remainder of our agenda is items 4 and 5. So we'll look to my fellow commissioner for a motion.
Mr. Vice Chair, I would move that we approve items 4 and 5 and all the sub-items appearing thereunder in today's agenda.
Second.
We have a motion and a second to approve items 4 and 5, including all sub-items. Any discussion? Any comment? Oh, Commissioner Jordan.
Thank you, Mr. Vice Chair. I just wanted to make a few comments on item 5A, which is, I believe, our opioid settlement investment priorities that we are approving today. I just want to say this resolution is the product of a lot of hard work over many months, particularly by county staff who have deep expertise and have studied this issue inside and out. So I wanted to thank them for all of their analysis, recommendations, the detailed work that they did to bring us to a day of action today, particularly Justin Johnson in Community Services and his team. There have been a lot of work from others in the prosecutor's office, grants, and others. So I'm happy to join my fellow commissioners to pass these priorities today, which commit the county to millions of dollars in investments right here in our region to expand treatment options for those suffering from opioid addiction, to boost prevention efforts and improve our ability to respond to this crisis. I think that we all know that this epidemic has caused so much damage in our community and all over the nation. The scale of pain for families of victims is immense. And these settlement dollars, I believe, are our chance to bring some solutions to the table to promote public health and safety here in Spokane County. I know also that many of us, in one way or another, know people impacted by this crisis. I wanted to say, when I worked as a former assistant attorney general over in juvenile court, representing Child Protective Services, got to see, unfortunately, many times how addiction can really spark crisis for many families and put vulnerable kids in harm's way. It happens practically every day in Spokane County, far more than it should. And I wanted to give a shout out to all of the folks in our community who are already quietly working to support people in and affected by addiction and that don't necessarily get or need a lot of credit. Social workers, nurses, counselors, treatment providers, medical professionals, support staff, court advocates, and first responders who go out and see overdoses every day, for example. I just have a lot of respect for what they all do. I wanted to say it's heartbreaking when families are broken apart by this crisis. It's also incredibly costly for our system to deal with that response. And so that's why personally I'm glad that, yes, today we are investing in immediate needs, but we have balanced our approach with upstream investments to support and stabilize children and caregivers who've been affected by this epidemic. I think that forward-thinking approach will pay off for those kids and for all of us in the long run. I wanted to say also there are other resources out there for people who are going through addiction. These opioid settlement dollars are one piece of the puzzle. In case anyone's watching, the Washington Recovery Helpline is one resource you can Google that's put out and promoted by the Department of Health. And I encourage anyone in need to reach out. At the county, our staff have really recommended, I think, a smart approach that's based on filling gaps in existing resources. So I'm thrilled that we are funding the expansion of our successful Crisis Stabilization Center with a sobering facility that will help triage folks in crisis to stability and appropriate treatment. And earlier on in this process, I asked for a way that we could have the public and experts weigh in and share their priorities with us. And so I'm pleased that the commissioners put out a community survey. We heard detailed comments from hundreds of community members about needs. And one of the top needs that came back in that survey was treatment, making it more accessible to people in need. And I think that public input is reflected in over $6 million today being directed toward either treatment facilities or services. Ultimately, what we're trying to do is get more folks who are suffering to stability, help, and health. And I think that these dollars will move us in that direction. So we're listening and we're acting. And finally, I just wanted to say a thank you to the team at the Washington State Attorney General's office, led by Attorney General Bob Ferguson, for their aggressive and determined leadership on this issue and holding these companies accountable. We are seeing millions of dollars come into our communities to help us combat this epidemic, in significant part due to the hard work of the AG's office in partnership with other local governments across the state. So it's going to make a big difference, and I'm pleased to support these priorities. Thank you.
Commissioner Waldref.
Thank you. Can you hear me okay?
Yes, we can.
Okay, great. I just had a few more comments to add. Thank you, Commissioner Jordan. I think you covered some of what I was going to some of the thanks and some of the appreciation. I do want to thank Justin Johnson with our Community Services Department for spending the last year really reaching out to the community, identifying priorities, and then people may say, well, I had an idea about putting funding into X or Y. And what Justin did was really look through all the suggestions and identify where there are gaps, like Commissioner Jordan said. So one of the big gaps in Spokane in our system of care and a way that we can remove barriers to people to be able to access treatment is having a sobering center. So one of our top priorities here in this resolution is funding the construction and servicing and operating a sobering center where folks can come in, be able to sober up, and then be able to enter treatment more easily. So I'm very excited about this opportunity. I'm hoping we can get federal and state partners to help us develop this center. But that's an example of where there's a gap today, and Spokane County is stepping up to fill that gap. The other major priority here is serving families with babies with neonatal abstinence syndrome. It is very, very difficult to help those babies and moms overcome and get them on their feet and stabilized. And so it is a new emerging area of medical care. And we're at the cutting edge here in Spokane with places like Maddie's Place. So I'm very excited about prioritizing that investment area for our future generations. So I'm very excited and happy to support this resolution.
Okay, any other comments? Seeing none, we have a motion. Items 4 and 5, including all sub-items. All in favor say aye. Aye.
Aye.
Aye.
Motion passes 4-0. That does it for our printed agenda. So I believe we'll ask Pat, send off the press release based on the opioid settlement that we just adopted. And I will look down to legal counsel and CEO Simmons. Anything else for today?
Nothing further from me, Commissioner.
Okay, nothing. Okay. All right. In that case, it is 2:29 and we are adjourned for the day.